This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
And Ryan Nilsestuen, Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Thank you, and thank you all for joining us again today. We've known for years that expanding broadband across Wisconsin was going to be a critical step for our future, which is why our last budget we made the largest state investment in state history in broadband. But folks, the COVID-19 pandemic has changed the way we learn, work, access healthcare, and connect with our loved ones, making broadband access perhaps one of the most important investments we can make. Wisconsin Economic Development Corporation's Wisconsin Tomorrow report indicated broadband access as one of the necessary strategic steps we need to take as a state to bolster our economy as it recovers from the pandemic. That's why I'm so proud to announce today that the State Public Service Commission and the Wisconsin Economic Development Corporation have selected 6 communities for their Broadband Connectors pilot program. This program will help local communities better access federal, state, and private sector broadband expansion grants by connecting them with technical assistance, support, and resources to be in the best position possible to compete for these grants. It is innovative programs like this that will help our economy and our community not only bounce back, but thrive in the years to come. Believe me, nobody wants to see that more than I do. Businesses across our state are hurting. I know that. And we need to do everything we can to help them. That's also why the same day I announced our order to limit public gatherings, I also announced more than $100 million in additional support for Wisconsin small businesses, from restaurants to taverns to music venues. But folks, here's the bottom line. The longer it takes for everyone to take this virus seriously, the longer it will take to get our economy and our communities back on track. Yesterday, there was a dangerous decision to temporarily put a hold on our order limiting mass gatherings. We'll be challenging that decision, but in the meantime, we have to stay the course. We're at a critical point in the battle against this virus. We've had many record-setting days recently for hospitalizations, new cases, and COVID-19 deaths. And just because some folks out there want to see full bars and full hospitals doesn't mean we have to follow their lead. If we want to get back to enjoying our favorite bars and restaurants, public events, and in some sense of normal, then we need everyone to take precautions to stay safe and stop the spread. Even the White House agrees. In this week's report for the state of Wisconsin, they said this, quote, "Lack of compliance with these measures will lead to preventable deaths," unquote. And that's just it, Wisconsin. It is preventable. We do not have to accept rising case numbers, and we do not have to accept community spread. We control our own destiny here. So I am once again asking everyone from Superior to Beloit, stay home as much as you can. Limit your outings to essential needs for the time being, like work or picking up groceries. And always wear a face covering when you are out and about. It was great to see that 72% of Wisconsinites support wearing face coverings in public. That's absolutely critical, but unfortunately, we still don't know where the legislature stands. So while you're staying safer at home, I am also encouraging Wisconsinites to contact their legislators. Ask them if they support our state's public health emergency, whether they support requiring face coverings in public places like 72% of Wisconsinites, and whether they believe the legislature should come in for a vote in advance of the November election. Because folks, especially in times of crisis, the last thing we need is more instability and uncertainty. What we need now more than ever is for legislators to step up and provide clarity and consistency to the people of our state. I know that we can and that we will get through these hard times if we band together. Look out for our neighbors and put science and public health before politics. That's what I'm going to do, and I hope Wisconsinites will join me. With that, I will now turn things over to Secretary-designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, and thanks for joining us again today. Across the state, we have now surpassed 1,000 COVID-19 patients who are in the hospital. In some regions of our state, our ICU beds are 90% or more full. And those numbers, while stark, don't factor in staffing shortages, which we are seeing in every region of this state. This surge in hospitalizations is the result of the surge in cases that started in early September. At that point, our 7-day average of new cases was around 700. 2 weeks later, that 7-day average had doubled. Because of the course of this virus, we can expect to see an increase in hospitalizations so long as we continue to see increases in our new daily positive cases. And so we know that this is going to get worse before it gets better. Today, our 7-day average of new cases is 2,927. Our average daily case number has more than quadrupled in 6 weeks. And those cases could become hospitalizations in the coming days and weeks. Our numbers are high and they're growing rapidly. Today, there are now 162,325 confirmed cases of COVID-19 here in Wisconsin. That's an increase of 3,747 over what we reported yesterday. And this is a new daily record. Our total deaths have now reached 1,553, which means that 17 more Wisconsinites lost their lives since our report yesterday. Over the course of the past 6 weeks, our average daily deaths have more than tripled. That is why we need the alternate care facility to be open and available for patients who need to be transferred from hospitals across the state. It is why we need to make sure we are doing all that we can to slow the spread. Stay home, wear a mask, stay 6 feet apart, wash your hands frequently. If you have symptoms or have been exposed to someone who is positive for COVID-19, get tested and quarantine while you await your results. Call your close contacts to alert them to your test, the fact that you might be positive, and encourage them to take action to help stop the spread by staying home themselves. And if you test positive, self-isolate to protect your loved ones and answer the phone when the contact tracer calls. And please, get your flu shot. It's another thing you can do to stay healthy and help preserve our hospital capacity. Wisconsin is in crisis, and we need to take this seriously. It is up to all of us to take action to prevent further spread and help Wisconsin get through this. Thank you.
Thank you. We'll now take your questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And we'll begin with Stephanie Hoff from WISN Politics. Stephanie?
Good afternoon, and thanks for taking my call. My question is for Secretary Palm. How many patients are at that State Fair Park facility today, and where do they come from? Will you guys be scaling up?
Thanks, Stephanie. Today we haven't had any admissions thus far to the alternate care facility, but as we have said and as we have been doing, we're in very close contact with hospitals and are talking about them with where they stand today and how things are shaping up among their admissions and discharges and their workload that they're seeing in anticipation of what might happen tomorrow. So we don't anticipate patients today, but are looking ahead to tomorrow and the days after that.
Thank you, Stephanie. Now to Juliet Alperin from the Washington Post. Juliet.
Hi there. Hi there. Thanks for taking my call. I was wondering whether either the governor or Secretary-designee Palm could talk about the phenomenon that you're seeing in terms of, for example, young people socializing at colleges or elsewhere, and then that spreading the virus to, say, elderly Wisconsinites, folks in nursing homes. Can you share with us any, patterns you're seeing along those lines? Thank you.
And I'll just start out by just mentioning that we do see certainly situations where super spreader events are happening when people congregate and young people congregate. And that's one of the reasons that we did provide the two orders, frankly, one around face coverings and the other is around public, people in public and mitigating what happens in limiting people going into various retail situations, including bars and restaurants. So we believe that we are trying to address that going forward, and we're very hopeful that we're going to, right now we're in court trying to save both of those orders, and we feel that it would make a big difference. But right now we are fighting Republicans and their allies, and having a difficult time fighting the virus.
I think the only thing I'd add to that, Juliet, is we, while we did, when our campuses first opened up, we did see across the state rise in cases among the 18 to 24-year-old age group, but most of our campuses have done an extraordinary job to turn the tide on that and get their positivity rates and their new daily positive cases down. We do, as the governor said, continue to need to encourage them to do the right thing as it relates to bars and restaurants and private house parties and the other kinds of gatherings that would encourage the spread of the virus. But what we are seeing now in the state of Wisconsin and have been seeing in recent weeks is very intense community spread in all age groups. And that is a sign that it is not just about young folks, that it's happening on a community-wide basis, and it really does speak to the need for all of us to do everything that we can to stop the spread, remembering that not all cases are symptomatic, that there are positive folks who don't have symptoms, and while that's a really good outcome for them, we certainly don't want them to be ill and have symptoms, but it means that they could be inadvertently spreading the virus. And so we need everyone to take this seriously, to understand what we're seeing in our hospitals and what we will continue to see in our hospitals until we all take the steps together individually that will, as a full state, as a community, really do what we need to do to stop the spread of this virus.
Thank you, Juliet. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi. The past 2 days, there have been some problems with the statewide registration system used by Alliant to register people to get tested. Can you talk about what the issue is, how it's affecting testing, and whether any other sites besides Alliant are being affected by this little computer glitch?
Yeah, Danny, so for others, what she's talking about is the registration system that we have deployed through our community, with our community testing sites around the state. And it allows folks who are coming to get tested to register ahead of time. It speeds the flow of information. It shortens lines at community testing sites because it's all stuff you can do before you queue up to get a test. So it has been an important addition, an important enhancement to our community testing across the state, and has increased our throughput and our ability to manage testing more efficiently and effectively, in partnership with Exact Sciences and the other Wisconsin labs that we are working with. We have, over the last couple days, seen some software issues with, we call it DTRA, with DTRA, and are working with Microsoft, who is our vendor on this product, to figure out what is happening so that we can get that corrected as quickly as possible, because obviously considering what I have just said about the benefits it has brought to us in our testing and its efficiency. It's a top priority for us to smooth out those issues that we have been seeing over the last couple of days.
Thank you, Danny. Now to Denise Lockwood from Racine County I. Denise?
Well, thanks for taking my question. My question is around the jail system. I'm wondering why the number of COVID cases aren't reported out with that section. I'm also told that from various sources, including inmates and also attorneys, that the inmates don't have soap, that they're wearing clothes for long periods of time, like a week, and that they have also not been able to bathe for days and a lot of other things. So I'm wondering if you're aware of these issues, and if so, how are you addressing them?
I can start.
I'll jump in.
Sure. So I think it's important to recognize there's a distinction between the jail system and the Wisconsin correctional system. So the Department of Corrections operates the prison system in the state. By contrast, county sheriffs are in charge of their county jails. And so it's definitely something that we can take a look into to see, see about these concerns on if they are occurring within a particular county's jail. In terms of the Wisconsin correctional system, though, they have been very aggressive in terms of making sure that while inmates' needs are met, especially in terms of personal hygiene and in terms of isolation and prompt testing in order to address COVID-19. So it's something we can look into in terms of the jail, a particular jail, though. Yeah, and the only thing I would add is around the Department of Corrections and some of the increases that we've seen. Yes, we're very concerned about that. We're working to get people isolated as quickly as possible. But the fact of the matter is the people that are in our care in these institutions, they stay there. And if you're having community spread across the state, of course, there's lots of people that work in those correctional institutions, caring for people, as well as lots of people that interact with, bringing food into the institution and so on and so forth. So anytime you're going to have community spread excessively, like we do now, because we're still trying to get around the issues of making sure people wear face coverings and stay socially distant, that shows up in our correctional institutions. And once we are able to make sure that people are safe and being cautious outside of the correctional institutions, we'll see a decrease in the numbers that we see internally.
Thank you, Denise. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi. Governor, the Elections Commission said today that there are about 50 communities that have severe shortages of poll workers. I'm wondering if there are any plans to help them open polling locations with Guard members again this time?
Yes, we will. The National Guard and leadership is actively seeking out folks to do that. So yes, the Guard will play a role as much as they are needed, and so hopefully we'll get those 50-some positions filled. I think there's some, little bit of confusion because there's something going on in the U.S. Supreme Court around this issue. One of the federal courts indicated that the Guardsmen and women could serve any place they wanted to, any place in the state, and of course there's what we believe is that they need to be actually live physically in the places where they serve. So that's still out there, but regardless of what the U.S. Supreme Court says, the National Guard will be there to make sure that we have enough people working in the polls.
Thank you, Molly. Now to Danielle Kading from Wisconsin Public Radio. Danielle.
Hi, thank you for taking my question.
You mentioned, Governor, that you're fighting Republicans and their allies right now on COVID-19 response. Are you planning to call them into session at all, or have you had any further conversations with Republican lawmakers or leaders over the latest emergency order restricting public gatherings?
Well, obviously we're in court with them or their allies and several different fronts, so we have to deal with that. We know what they're against. They're against wearing a mask, and they're against having a limiting some public gatherings. Other than that, we don't know what they support. And I believe it will happen at some point in time that I'll hear from one of the leaders, and they'll be saying this is what we can support and this is what we can't. So I'm not sure. Just calling, I've had lots of people say call them in every single day until they come in and tell you and reach some conclusion. Now that'd be fun, obviously for some people. I believe they're adults, and they will at some point in time decide this is what we can support, and let's get together and do that. Unfortunately, we can't wait any longer. We can't wait much longer. We should have known this months ago, because when we were with the Supreme Court last spring, they said they had a plan. So waiting for it.
Thank you, Danielle. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. I was wondering, are you guys planning to report the number of patients at the alternative care facility publicly, like on a daily basis, like you do with the COVID numbers in the future, or if you have any plans to do that? Thank you.
Yeah, Sean, I appreciate the question. We absolutely intend to provide some information through our daily updates, through that regular cadence of the updating of our website with information about our census at the alternate care facility, and we'll do that, upon arrival, the following reporting period upon arrival of our first patient or patients. So we absolutely will.
Thank you, Sean. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Hello, good afternoon. Thank you again for taking the call. Governor Evers, you mentioned in your remarks that you had up to that White House Coronavirus Task Force report talking about Wisconsin. I wanted to, again, just kind of see what your reaction was to that. And if you could kind of touch on kind of the federal resources that are kind of mentioned in that report, about whether it's FEMA or CDC, and if there are any additional resources headed towards Wisconsin in any of your discussions that you've had with the task force and other federal officials.
Yeah, and I'm going to let Secretary-designee Palm answer that question, but we received their report. We actually had a chance to talk to Ambassador Birx the other evening, and we made some requests as a result of that meeting.
So throughout the course of the response, we have had a number of resources from the feds, a number of CDC teams that have helped with investigations and outbreaks in various parts of the state. We had a visit earlier this week from part of the Assistant Secretary for Preparedness and Responses team to do some work around a surge. They visited the alternate care facility as well. We are receiving some surge testing supplies from the U.S. Department of Health and U.S. Department of Health and Human Services, and we will start to deploy those in the Fox Valley in the coming days with some additional community testing capacity there. And so FEMA has provided stuff. We have the U.S. Army Corps of Engineers. We have requested, and they are coming back to join the team as it relates to thinking about whether or not we might need additional alternate care facility space. So we tap into the federal assets when we can and when they're needed. They often are able to fill those requests. Sometimes they have not been able to, but we certainly appreciate their partnership in making sure we have what we need here in the state of Wisconsin.
Thank you, Victor. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo?
Hi, thanks for your time. If I heard correctly, I believe Health Secretary-designee Palm mentioned earlier during the Q&A that they were not expecting any patients at the alternate care facility here in Milwaukee at State Fair Park. But in the last few moments that we've been sitting here, we've seen, I think, at least 3 Bell ambulances pull in. Can you explain just what that might signify for us?
Well, since I've been sitting here without access to an electronic device, I don't have an answer to that question, but we would be certainly happy to get back to you.
Thank you, Mary Jo. Now to Terry Sater from WISN TV in Milwaukee. Terry?
Good afternoon. My question is for the governor. Governor, given that the White House report says that Wisconsin needs to increase mitigation efforts, given that the White House report says that Wisconsin needs to increase other mitigation efforts, Governor, why is it that many Wisconsinites are not listening to you, and what can you do to get them to listen to you?
That's a great question. We will continue. I will continue talking about it. The people at the table here will continue to talk about it. We actually talked about it with Ambassador Burks the other night. We need to make sure that we're using every possible messenger on this. I mean, obviously, the White House Task Force is a good messenger for us. I will say that. And I've tried to avoid this discussion, but the leader of the free world hasn't signed on to this, frankly. And the inconsistency from the White House, from our president, has not helped. And we're in the middle of an election for president, and people are picking sides here. And unfortunately, this is playing out as it relates to this pandemic. So that's why I'm reaching out and publicly and any other way to the Republicans in the state to see if we can get behind something. It seems inconceivable to me that southern states with Republican governors and Republican legislatures can and have implemented severe mitigation strategies, not just 25%, but closing things down just within the last couple of months. So I'm hopeful that the Republicans will come up with a plan that will actually bend this curve. I don't know what it can be without masks and without mitigating with limiting public gatherings. Maybe there's something that we haven't explored yet. But at the end of the day, if that doesn't happen, and it could be that doesn't happen, we will continue to be messengers for this ourselves and eventually get that 72% up to 92, 95%, so that people understand we can prevent deaths. We can prevent deaths. I don't know how anyone in the state of Wisconsin can feel comfortable about saying, what the hell, I don't care about preventing deaths. That is unimaginable to me. So we have to step it up. We will continue to be the messengers. We'll find other messengers that might be appropriate, that reach out to 30% of the people that don't believe in this, and we'll continue the fight. This is becoming life and death for folks in the state of Wisconsin. It's not just about the economy. I care about that. I care about jobs. We're trying to do everything we can to mitigate the economic distress that people have. We put out hundreds of millions of dollars to small businesses in the state, and we'll continue to do that. But we don't want to have to continue to do that forever, because we have to first and eventually make sure that this virus is stopped in Wisconsin.
Thank you, Terry. Now to Mason Dowling from WAOW-TV in Wausau. Mason.
Hi, Hi, thanks for taking this call. This question is for, well, realistically, whoever wants to answer it. We're currently investigating another rise in cases at the Veterans Home in King, Wisconsin. They also just recently reported about 30 cases or so in the span of 1 week. I wanted to know if, Governor, if your office or the DHS was monitoring the situation not only in King but in veterans' homes across the state.
Yes, I can't give you the specifics, but absolutely, we have discussions with Secretary Kolar regularly about this. The nursing homes that have our veterans in it are very, very important to us, and we have great people working there. But again, no matter the institution, whether it's a correctional institution, whether it's a nursing home, the spread across the state and what is directly related to the spread we're seeing in our veterans homes and in our Department of Corrections, the people with that we care a lot about.
Thank you, Mason. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yes, thanks for taking my question. Governor Evers, you had mentioned before that 72% of Wisconsinites support wearing masks in public, and I suppose this question is for really the healthcare officials more than anyone else. 72% tracks pretty much with what we're seeing in the rest of the country. With that being the case, why is Wisconsin seeing numbers so much higher? I mean, everywhere else has colleges, everywhere else has bars. Why are we seeing the spread here so much more than other places in the United States? Thank you.
Well, I'll just jump in there. It's not masks are important, but there's all sorts of other mitigating efforts that have happened. And I'll go back to what I said before. In southern parts of this country, we're going through this, frankly, not as seriously as we're having it, and they have at their disposal things that we don't, and it has a lot to do with closing things down. I mean, we didn't even have a lockdown last spring, more or less now. So they have a lot more tools than we have in their toolbox, and what we're trying to do is do what we can do to make sure that the ability to mitigate this with the small number of things we have at our disposal are used widely, and that is our ultimate goal.
That's exactly right. Thank you, Rob. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for the call. Governor, could you talk a little bit about how concerned you are given the surge we're seeing with kind of last-minute issues at the polls, with maybe poll workers backing out because they get sick or being afraid of going because of the surge, just other issues that would present themselves related to November 3rd?
Yeah. Yes. I obviously having an election during a pandemic is pretty tricky business. And so that's why I'm very happy, and that, we've already had, I think it's well over 700,000 people vote by mail already, and that number will climb into over 1 million before this election's over, and maybe even 2 million. That's one way, and that's a lot. That's a great percentage of the people voting. Also, our poll I have to just say this as up front. The people that work and lead those people that work in the polls, all those clerks across the state, whether they're in big cities or small townships, they deserve medals of honor. They have made exceedingly difficult decisions around making sure that they have the guards up and make sure that people are going to be physically distant. That began with the April election, and it's going to continue in this election. And also we'll have large numbers of folks voting early, starting next week. I believe that date is in person. So we have 3 extraordinarily robust areas where we will have lots of people voting. And I feel good about where Wisconsin is. People are geared up, obviously, to vote. People are geared up because they're engaged in this election. I believe that whether it's mail-in balloting or in-person early balloting or in-person on the day voting will be safe and will be effective, and we'll have a good turnout here. That doesn't mean that there aren't going to be people out there raising red flags around whether things are going to happen with the mail. I don't believe that that's an issue at all. We have the Attorney General who is poised on the legal end of things to take things to be ready for any kind of legal challenges. We also have the National Guard and other units of our state government that are working around this cybersecurity piece. I believe are ready. People are ready to have this election over, and I think it will be a successful election with very few hiccups.
Thank you, Scott. Now to Katie Anderson from WBAY TV in Green Bay. Katie. Again, Katie Anderson from WBAY. Okay, we'll move on then to David Wahlberg from the Wisconsin State Journal. David.
Yes, thank you. You talked about how there is intense community spread in all age groups. Can you say within the last week or two what contact tracing has identified as the most common source of infections? Is it bars? Is it gatherings at homes? Is it weddings? What are we seeing?
Well, we do update the outbreaks website once a week. Traci may want to dig into some of the details of that, but I think, David, the issue is that at this point, the intensity of our community spread makes it really difficult to trace it back to a single source. Contact with folks outside your immediate family in enclosed places is spreading the virus. And the more people who are positive, the more there are to spread it, which is why you see the escalation in our curve. At the steep incline that it is, it's because it's a bigger denominator, and those folks are spreading to more people than a smaller denominator would. I think people should think about all of the things that they're doing outside of the confines of their immediate families as a potential place that they could be coming into contact with COVID-19, considering how intense the community spread is, and to make choices not to do those things. Now is the time to make the choice not to do those things. I don't know, Traci, if you want to add anything more specific on what you're seeing in the data.
No, I think you're spot on, Andrea, and we really just want to encourage people to continue to stay at home, avoid large gatherings, wear your masks when you have to go out for those essential items, and make sure you're maintaining good physical distancing.
Thank you, David. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline.
Hello, my question is for Andrea Palm. You had said earlier that the surge in hospitalizations currently is the result of the surge in cases that started, I believe you said, in early September. And in early September, we were having 300 some new cases a day. Now that we're having 3,700 new cases, I mean, what are you anticipating we're going to see for hospitalizations in a month's time? Thank you.
Yeah, I think that's right. That's exactly it's exactly the point, Madeline. Right? We as you see increasing number of cases, you're going to see increasing numbers of those people need hospitalization. Right? Again, it's a larger denominator. So you are at risk of a larger number of that total becoming severely ill and needing more care. And that is right as our numbers, as I mentioned, have quadrupled in the last 6 weeks. we are now in a place where we're seeing hospitalizations exceeding, 1,000 folks today who are hospitalized. And so it's really important that we understand that we sow the seeds of future hospitalizations upon the day of infection. And so hospitalizations and death are a lagging indicator, and it is why we say it will get worse before it gets better, because to your point, the number of cases we are seeing, the records we are breaking here in recent days and in recent in the more recent past will result in hospitalizations and deaths as that lagging indicator, as that infection progresses, and those folks who are going to have symptoms, who are going to have more severe illness and are going to need hospitalization, that comes to fruition. And so we need to do all that we can right now to break that transmission, to stop the spread, but it will take time before we see the fruits of that labor in reduced hospitalizations and reduced community spread. But now is the time so that we don't get to a place where our hospitals and our staffing shortages are worse than they are right now. It is why we need the alternate care facility, because we are anticipating that it will take this, the couple of weeks or more to get to a place where we are seeing a decline in hospitalizations as that lagging indicator to infections that we're seeing on a daily basis now.
Thank you, Madeline. Now to Jonathan Nizer from NBC 26. Jonathan?
Yes, I believe it's been a few weeks since there was some reporting about how rapid tests were going to be becoming available, and there were several hundreds of thousands, I believe, being deployed. And it sounded like they were going to go to hotspots, which clearly Wisconsin is one. So are rapid tests available? Are they going out to nursing homes in Wisconsin, or what's the timing of when we can expect to see that?
Yeah, so there are a couple of things going on in that space. One, skilled nursing facilities, nursing homes did receive directly from the federal government a startup supply of rapid tests. Nursing homes in the state of Wisconsin have received that supply. In addition, we at the state of Wisconsin, through our testing infrastructure, are wrapping around what they have to provide the kind of testing that is necessary to be compliant with federal requirements around testing for staff and outbreaks in nursing homes. And so rapid tests to nursing homes, plus the use of our testing infrastructure to help further make sure that we're doing everything we need to do as it relates to testing in nursing homes. But also we have received at the state the first part of our allotment of additional rapid tests, which have been deployed to healthcare. I think we have received we've got another shipment today, which is being packaged up to be deployed across the state. And I think our total is right around 300,000 rapid tests so far. But we have prioritized for that tranche of our allocation healthcare, again, because we know that our staffing shortages in those locations can be mitigated with access to rapid testing, so that those folks who do not need to remain out of work can come back more quickly and ease some of the shortages that our hospitals are seeing. So two different sets of assets, some to skilled nursing, some to the hospitals around the state. We do expect to receive a little bit more in our allotment that we have thus far sent to hospitals, and are working through how to continue to deploy those so long as the federal government has the capacity to send us additional supplies of those rapid tests.
Thank you, Jonathan. Now to Lane Kimball from News 3 Now in Madison. Lane.
Hi, this is Adam filling in for Lane. I had a quick question that anyone can really answer, and it's kind of similar to a question that was asked just a moment ago. But as far as limiting the spread, we hear a lot about avoiding large gatherings. But at this point, are we seeing the virus spread with smaller gatherings like baby showers or Packer watch parties? when you have about a dozen or so people spending, a couple hours with one another. And I guess, how does this impact how you're advising people to gather, even in smaller groups of 10 or less?
Absolutely. Small private gatherings, dinner parties, you mentioned Packer watch parties, retirement parties, birthday parties, baby showers, weddings, all of those things. That's why we have been encouraging here in recent weeks that people stay home as much as possible and limit contact with people outside of your immediate family. That's sort of like we were all doing together in the spring. We stuck to our family unit, and that was to protect that unit. While again, this asymptomatic spread, people with mild or no symptoms can be inadvertently sharing the virus at a dinner party, at another small gathering, and considering how widespread our infection is across communities right now. Every new infection is we just are in a place where we need to stop it as much as possible. So you're exactly right. I think we should be limiting our interactions with people who live in our household. That is the safest thing we can do. It is the way we will protect our healthcare workers, our corrections workers, our workers at our DVA veterans homes, our workers across the state, our workers in grocery stores, et cetera. We need to be doing everything that we can to stop the spread of this disease, and that means stay at home as much as possible and limit the number of people you interact with to your immediate family.
Thank you, Lane. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben.
Hi, thank you for the opportunity. A lot has been made today that 30% of people don't believe in or are not supportive of wearing masks. Is there one study or piece of evidence that you can point to right now that leaves no doubt that masks work? Something perhaps that mask supporters can use when they encounter someone who's a skeptic.
Mm-hmm. So I'll say a couple things about this, I guess. When this pandemic first started, the science was not really robust about wearing a mask, right? We weren't recommending it. In fact, we were recommending against it because we needed to. We were having PPE shortages, and we needed to preserve masks for our healthcare workers. And like so many other things in this pandemic, the evidence has evolved, information has developed. We learn from this virus, we learn from each other, we learn from other states and other countries. And the evidence around wearing a mask has absolutely developed and grown. And you see it now as a baseline mitigation measure to stop the spread of this disease. There is not a doubt that it works as a mitigation strategy. My mask protects you, your mask protects me. And so I would encourage folks broadly to wear a mask whenever they are outside of their home, to protect each other, to stop the spread, and to start to get us back on the right course in combination with physical distancing and the other mitigation strategies that we've talked about. I don't know, Traci, do you want to say anything more specific?
No, I think that's spot on, Secretary Palm.
I mean, there was a health affairs study recently. We're happy to get you some citations if that's what you're looking for specifically, but the evidence is clear.
Thank you, Ben. Now to Jeff Dada from Spectrum News. Jeff?
Hi, thank you for holding this call. Governor Evers, you had said that your administration plans on challenging the order striking down the 25% capacity limit. I don't know if you can just explain why you feel like the limit isn't the right legally, and given how previous decisions have held up in court this year, are you hopeful that this one will be reinstated?
Sure. This is Ryan Nilsestuen, and I'd be happy to answer that. As we've explained before, it's a very targeted, narrow order to limit mass gatherings in the state. State law explicitly gives DHS the authority to limit public gatherings in schools, churches, and other places, and that's exactly what it does. We think it's consistent with the Safer at Home lawsuit or decision that the Supreme Court issued earlier this summer. And so I think it's not only the right thing to do legally, but it's also the right thing to do considering the surge we're seeing in the number of cases, the rise in the number of hospitalizations, and the rise in number of deaths. This is an important tool to be able to combat the virus.
Thank you, Jeff. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking the question. Is there still a significant portion of our testing capacity that is not being used day to day? And is there any greater clarity on the reason for the gap between the capacity and the actual amounts of tests being conducted? Thank you.
Yeah, so Eric, we sit today with testing capacity in the state of just over 42,000 tests. Our 7-day average of tests utilized is somewhere right around 27,000, 27 and change. And so we do have some excess capacity in the system and continue to encourage folks who have symptoms or who have been in close contact to get tested. We are deploying some new strategies to bring more community testing to more communities across the state in hopes that increased access, increased availability of testing across the state will help bring us to a place where we are utilizing more of our capacity on a daily basis. Some of that has started to be deployed even today. A new site in Appleton, for example, opened today. But we are working hard with our local emergency coordinators in the regions across the state, our hospital systems, and our local public health to again bring as much community testing out across the state as we can in an effort to maximize our use of our capacity so that everybody who needs a test really has more ready access to it closer to home.
Thank you, Eric. Now to Amy Flugstaff from NBC 15 in Madison. Amy. Amy from NBC 15. Okay, we'll move on to Chuck Kornbach from Milwaukee Public Radio. Chuck?
Good afternoon, Governor. You referred to President Trump. I might have missed. Did you comment about his rally in Janesville and whether other political rallies, Trump or Pence or others, have contributed to spread in Wisconsin yet?
Well, certainly when you bring numbers of people together, like we have seen with the Trump family, as you've seen with Vice President Pence. And you have seen with President Trump when he has been here, it's bringing a bunch of people together that aren't wearing a mask. And to me, our orders do not prevent political events. The order has nothing to do with that. But all I can say is that everybody knows, not everybody agrees, but everybody knows that masks work. And I would encourage any politician that's having an event in Wisconsin, whether it's Eric Trump or Vice President Pence or the president himself, that they have control over that crowd. They can tell them, if you don't wear a mask, you'll have to leave. And that would take care of most of the concerns I have and the public health experts. They are unwilling to do that, obviously, or they would be doing it. And so, yes, I know I've heard that President Trump is coming to Wisconsin, to Janesville. I don't know the date, but unless something extraordinary happens between now and then, he'll be encouraging a super spreader event. And as governor of the state of Wisconsin, I sure would ask him personally, have people wear a mask, have them be physically distant. I don't think he'll do that. There's been no indication that he's willing to do that, and that's just a problem. That's a wrong message. That's a wrong everything.
Thank you, Chuck. Now to Maddie Heim from USA Today Network, Wisconsin. Maddie?
Hi. So just to get back to the task force report, so it talked about low adherence to mitigation measures here and talked about how not only public education, but enforcement measures should also be enhanced. And so given the constraints that you've talked about from a statewide level, are you encouraging local health departments to ramp up that enforcement at all? Do you think that they should be taking those measures locally to improve that?
Well, we have been working with local public officials on that, and some of them have been able to do that, some of them haven't. To some extent, their ability to step in and require mitigation is limited by politics of this virus, and therefore they are unable or are frankly unwilling to do anything at the local level, and that just is something that. I hope people in Wisconsin are watching because you think about our public health folks that work at the local level, and frankly, some of the difficulties under which they work, it's breathtaking to me. And they're just trying to do their job. They're recommending the best things they can. I know there will be differences of opinion, but it has become so difficult for them to operate that public health as a value in our state has suffered, and there will be consequences beyond this pandemic for public health in the state and frankly the country.
Thank you, Maddie. Now to Will Keneally from PBS Wisconsin. Will?
Hi, can you hear me all right?
Mm-hmm.
Wonderful, thank you. So are there any contingencies to go beyond November 3rd, or conversely, like what should people expect for how long it will take to get election results?
I missed the very last part of your question. After November 3rd,
how long should Wisconsinites expect for it to take for the state to get election results back?
To get election results back.
Oh, thank you. I missed the last part of it. I know some of our larger municipalities have purchased more machines to count ballots, and so that I do know, and that will help us. I mean, I wish we would be able to trust our clerks to count beforehand. And I'm guessing at some point in time we'll get legislation to change that, but they are relegated to counting the day of the election, and they'll start early in the morning. The good news is that I know some more machines have been purchased by some of our larger municipalities, which will help. I believe that we will be able to know the results of the Wisconsin election hopefully that night, and maybe at the latest the very next day. I know there's lots of ballots to count, but I think we're in a much better position to count those than we have been in the past.
Thank you, Will. And our final question today goes to no name given from WXOW in La Crosse. WXOW. Okay, well, with that wraps up today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.